Hello, welcome to the Lancet's Publishing Excellence Programme. I'm Anna Clark, Editor-in-Chief of the Lancet Rheumatology, and in this module we'll cover what editors are looking for in a successful manuscript and what to include when you submit your paper to a Lancet journal to make the publication process as quick and efficient as possible. So first is perhaps the most obvious, but your work should be relevant to the journal and the journal's readership. Sometimes this is very clear-cut, other times it might be a slightly trickier question. We carefully consider the study design and methodology and the accuracy and transparency of the reporting in all papers. Methodological considerations include things like whether the study has a sufficient sample size and thus statistical power to produce robust conclusions, and how strong the design of the study is, for example, comparator groups or independent validation. We also consider whether appropriate guidelines have been followed, for example, CONSORT for clinical trials, and whether the data are reported in an accurate and in an unbiased way. We also make sure that studies have appropriate ethics approval, including informed consent from study participants. And for clinical trials, we expect that they've been registered ahead of patient recruitment. In addition to positive attributes that editors look for, there are also some things that we do not like to see. These include poor design in terms of chosen endpoints or patient populations. And unfortunately, this is something that might not be apparent until after the trial has started or completed. And depending on the study, a lack of a comparator group can be a drawback. When thinking about trials in particular, extremely small studies that are underpowered to provide conclusive results, an over-reliance on exploratory analysis, sometimes we see this in trials where the primary endpoint is otherwise negative, and a lack of trial registration are all common reasons that we might not consider a submitted study. For studies involving predictive tools or risk stratification, a lack of an independent validation cohort is a major drawback. And then more generally, we don't like to see studies that focus on a very incremental advance on prior knowledge or one minor endpoint of a much larger study, often referred to as salami slicing. So going beyond general guidance and getting into the nuts and bolts of preparing a paper for submission, the first suggestion is that you read the journal's information for authors, which provides guidance on how to format the paper and what forms are required for submission. Although much of this will be consistent from journal to journal, it's really worth reading the fine print, and this is likely to save time in the long run. For Lancet journals, you can find our general guidance on the journal's About page using the link on the slide. We also have a handy pre-submission checklist, and our information for authors provides detailed guidance on reporting of sex-based and gender-based analysis in line with the SAGA guidelines, and also for reporting on race and ethnicity in studies. For interventional clinical trials, it's essential that you register your trial before you start recruitment. This is crucial for many reasons, as shown on the slide, and most high-quality medical journals, consideration of a trial will be contingent on prospective trial registration. Trial registration sites are also readily available resources for physicians and patients who might qualify for a trial. So it benefits everyone to make sure trial registration is done as early as possible. Also critical for trials is the trial protocol, which serves a number of purposes as outlined here, all of which help to ensure accuracy and transparency of reporting the data. As with trial registration, most medical journals will not send a trial for peer review unless the full protocol has been submitted alongside the manuscript. For papers submitted to Lancet journals, we also request a research and context panel. This is a narrative panel divided into 3 sections. that gives you an opportunity to provide a concise summary of your research question, the results of your study, and why they matter. This is something that must be submitted for your paper to be sent for peer review. So once you've constructed your paper and about to submit it, you come to the covering letter. Although there are no hard and fast rules here, my personal preference is to keep the covering letter brief. Resist the urge to reiterate the entire introduction of your paper, remembering that the editor is about to read the paper in full. Instead, take this opportunity to provide the editor with any potential pertinent information they might need and is not in the paper itself. For example, you could indicate if the submission was invited by an editor or discussed with an editor and it is in response to a call for papers, if you're presenting the data at an upcoming conference, or if it's relevant to impending government or regulatory decisions. You should briefly describe the findings and importance of the study and tell us about any peer reviewers who should be excluded. And also let us know if your paper has been reviewed elsewhere and provide the reviewer comments if possible. Do not duplicate the abstract in full, oversell the importance of the data, request too many peer review exclusions, and do not write more than one page. Thank you for joining us today. I hope you'll also check out the rest of the Publishing Excellence modules.